Welcome to Emergency Insights. I'm James Carter, and today we're joined by Dr. Emily Wang to discuss a critical topic in emergency medicine, decompression sickness. Dr. Wang, thank you for being here.
Thanks, James. It's a pleasure to be on the show.
Let's dive right into it. Decompression sickness is a condition we often associate with divers. Can you explain what causes it and who is at risk?
Absolutely. At its core, decompression sickness, or the bends, is caused by a rapid decrease in ambient pressure. Under high pressure, inert gases, mainly nitrogen, dissolve into the body's tissues and blood. When that pressure drops too quickly, these gases come out of solution and form bubbles. These bubbles can then obstruct blood flow, cause tissue damage, and trigger inflammation. While divers are the most common group at risk, we also see this in caisson workers, high-altitude pilots, and even astronauts.
That's a great explanation. Now, you mentioned the bends, which is one of the classic symptoms. Could you elaborate on the different types of decompression sickness and what symptoms healthcare providers should be looking for?
We typically categorize it into three main types. Type 1 is considered less severe and is often referred to as pain-only decompression sickness. The most common symptom is deep aching joint pain, particularly in the knees and shoulders. You may also see skin changes like mottling, itching, or a rash, and sometimes localized swelling, which is actually a sign of lymphatic obstruction. Type 2 is more serious because it affects vital systems. This can present with neurological symptoms like ascending paralysis or a sensation of truncal constriction, vestibular issues such as vertigo and hearing loss, and cardiopulmonary complications like a cough, chest pain, or shortness of breath. Finally, type 3 is the most critical. It's a combination of decompression sickness and arterial gas embolism, which presents with stroke-like symptoms and often occurs immediately upon surfacing.
The symptom timing is also crucial. When should providers expect these symptoms to appear after a patient has been exposed to a risk factor?
Most symptoms will appear within minutes to several hours after surfacing, but it's important to know that a delay can up to several days. It's also important to ask about a history of repeated dives or recent flights, as flying too soon after a dive can precipitate or worsen symptoms due to the further decrease in atmospheric pressure.
Once a patient with suspected decompression sickness arrives in the emergency department, what are the immediate steps for diagnosis and treatment?
Diagnosis is primarily clinical. You rely on the patient's history of exposure and their physical findings. While lab work and imaging can be helpful to rule out other conditions, especially with neurological or cardiopulmonary symptoms, they are not definitive. In terms of treatment, the most critical steps are immediate administration of 100% oxygen via a non-rebreather mask, providing intravenous fluids, and arranging for rapid recompression therapy in a hyperbaric chamber. We also recommend placing the patient in a supine position, but it's crucial to avoid the Trendelenburg position.
And what does recompression achieve?
Recompression is the definitive treatment. It works by physically shrinking the bubbles, promoting the elimination of the inert gas, and restoring blood flow to ischemic tissues. The U.S. Navy Treatment Table 6 is a common protocol, which involves pressurization to 2.8 atmospheres absolute. Early treatment is absolutely key to a good outcome.
Dr. Emily Wang, thank you so much for shedding light on this important topic. Your insights are invaluable for our listeners.
My pleasure, James.